So hello to all the viewers. I'm proud to have with me Dr. Sai Krishna, who has got an amazing rank of 2 in both the Common Merit List and AIIMS Merit List of AIIMS DM Neurology entrance exam. And that too, he is almost finishing his final year MD. So big achievement, hearty congratulations, Sai.
Thank you so much, sir.
Sai, to begin with, tell us a bit about yourself. You're from which place? Where did you do your MBBS and then obviously MD?
Yes, sir. I come from Bangal, Telangana. I did my till 12th. I did from my state, and MBBS I have done from AIIMS Bhopal, 2013 batch. Okay. Then in 2019, after 6 months of break, I took joined as MD medicine in AIIMS New Delhi, and I'm continuing it. It's going to complete by end of the July.
But you know, it's not going to complete. You are going to carry on with your stint in AIIMS Delhi probably. Okay, so with such a good rank 2. And so just tell me one thing to begin. When did that feeling come? Okay, I'm going to choose neurology for my super specialty.
Yes, so that's actually that is a tricky question for me, because I think I have decided, I had thought of at least 4 subjects before coming to neurology. Okay. I first, my interest was in cardio, but I didn't have much exposure of any super specialty in my MBBS days. So after coming here, I got to know about each specialty in detail. The turning point was neurology posting, which I got late in 5th semester because of COVID. And when I saw Professor Padma, Professor Rohit Bhatia sir, and Anu ma'am, and Professor Mamata ma'am, and Rupa ma'am, I saw them from close, and I have seen how good the neurology. They taught me some of the best neurology, which I didn't learn for a long time. So seeing them, I was very impressed. Whole like thought process of neuro, how the neuro is going to be, entire changed actually after seeing them. Then I started considering neuro. Okay, why not neuro? And coupled with that, that was the first interest that I found the interest in neuro, and I thought how it would be. Would it match my future plans? And it was perfectly matching with that. So I thought I would take it.
All right. And speaking about the exam, many viewers would want to know from you. There will be a lot of AIIMS exam aspirants. So preparing for neurology, what would be your advice to your juniors about the exam pattern? So AIIMS 80 questions. How is the spread of questions?
Sir, in this paper, I have seen only this paper. So in this, I have like at least 50 questions were from neurology and nearly 30 questions were from medicine. And there was actually the neurology questions. This time paper was actually very easy. So they stick to the basics, and they stick to the same key topics like stroke, epilepsy. There were at least five questions of that. At least around 10 to 15 questions of only these 2 topics. And medicine questions were also actually very tricky. Those are the common questions which we faced in PG also, and we tend to do wrong now because they are tricky questions. So the key thing is that they will ask the same topics, important topics, and in different ways with different options to confuse you. So those topics, they will check only the basics. They will not ask very high stuff. So you need to be very confident and thorough in concepts of those topics. I think that should be the first in preparation of for any set.
Very important point that Sai said. See, sometimes you can even have simple questions also. So it's not like it is, yes, obviously it is INI. You're going to have tough questions, but you should have a good range as a candidate. Even if you are asked some simple, straightforward questions. Because in medicine segment of INI, there were some basic questions on heart sounds, basic murmurs, which probably is a question you might expect for your NEET PG or your INI CT exam, but you can expect it for AIIMS because your basic should also be thorough. So that is what Sai is trying to tell us, that the question had a decent spread. And he's right when he says that compared to the previous AIIMS, this exam was slightly on the easier side. Okay. Now, a question which every medicine resident, Sai, would want to know from you is, what percentage of questions from neurology did you get from Harrison? Harrison alone, what percentage of the neurology questions were from Harrison? And probably, maybe medicine also, you can have a comment on that.
I would say, sir, majority of the questions are from Harrison itself. So it would be hidden somewhere. You need to search. Actually, not only the neurology part. Actually, Harrison has divided different topics in different chapters. Like vasculitis, you have to go for rheumatology, and basic neurological symptoms like approaches. It is given in the first chapters. If you read Harrison, if you have a good idea of Harrison, and every question is from Harrison, just you should know where you have to read it from. So I would say at least 90% of the questions, including medicine and neurology, came from directly from Harrison.
Okay. And something very unique about Sai's preparation is that he has studied Harrison very well. At the same time, he has gone a bit extra also. For example, Sai has, I think, gone exhaustively through our question bank also of DocTutorials, where questions were mostly Bradley based. So I think from what I understand is his preparation strategy was like, see, if I get questions from Harrison, well, I'm prepared for it. And even if the examiner goes one step ahead with questions from Bradley, I should prepare myself for it. Am I right?
Yes, sir. I had a short time actually because I started it in February. I had only 2.5 months, and it was actually hard task to complete having MD exams finals on my head. So I actually my primary was Harrison, and I got some material, like especially the Bradley tables, which is the compiled one I got from my senior. And that thing, and the last DocTutorials. Every question in the DocTutorial app is actually will teach you something, either reinforce the existing topic or teach you something and give you a very good crisp description of from the Bradley. That is the best part. Whatever I had missed from the Bradley, I got it from DocTutorials.
Okay. All right. So Sai, once the exam results were announced, and you wanted to prepare for interview. So in that 7 days, we had formed a WhatsApp group for preparing for the interview round. So how did you get to know about the mock interview sessions that we were actually conducting? Because I have been conducting this for some time. So how did you come to know about it?
Sir, actually, all of my seniors, I think everyone whomever I have spoke to, everyone has mentioned, talk to Dr. Rajeev says, Rajeev sir is he prepares you best for the interview. I got to know it late, but I got all of that information that I have to contact you through my seniors, and all of them have recommended to participate in that mock sessions.
So when you participated in the mock interview sessions, did that actually help you get an overview of what probable questions you can expect? Because obviously neurology is a vast subject, and it's not possible to cover everything in that 1 week gap between the announcement of the exam results professionally for those candidates who qualified for the interview and the interview. But still, I had shared with you in that WhatsApp group all the questions that were asked in the last few years in the interview sessions, which I collected from my students of the previous session. So did that give you an overview? Okay, this is probably what I should expect.
Yes, sir. Actually, the key thing would be actually how to present it to the faculty. When some question is asked, you should know how systematically you have to go, and you need to speak loud. You need to be confident. That's what these mock sessions are, and I think I have gained that through these mock sessions.
And also in the mock sessions, you also get to know how your other candidates are doing. So you get to know, okay, this is what I should have at my level. So it helps you shape accordingly also. Now, just tell us one thing. What is that an AIIMS faculty expects during an interview on your perspective? Because MCQ round is over. Now, when it comes to interview, what do they focus in the interview?
They ask the basic questions. They see the approach, how you are approaching. Even you don't hit the right diagnosis, the way you are approaching the patient, when the patient comes, you have to start with the basic thing. It's not just jump to the diagnosis. So they mainly focused on how I describe the image, how I describe the radiological findings, and how I approach a case when patient presents to emergency or to OPD. That's what they have more focused on. Sir.
Okay, all right. So when you gave that interview, after that, the day the results were actually published, did you know that, okay, I'm going to be in the top 3?
No, sir. No, not at all.
Okay. So how did you come to know about the rank?
Actually, my senior called me and said, and my juniors also called me and said that.
Okay. Okay. So it must be a dream come true moment again, continuing. Okay. So it's such a big rank. Okay. And the best thing about that is that you have done it in your first chance itself. And when I see you, I still remember candidates like Abhishek also. I still remember he got a rank, and I think probably next day he was having some exam in his final MD exam. Abhishek is there in AIIMS Delhi, and so is Mohit. Mohit is also there in AIIMS Delhi, so he should also be your senior in DM Neurology. So it's great that you have cracked this in first attempt, so that you can finish in one go itself, and then you can start your practice also. So how relieved are you, Sai? You don't have to waste another year, and you can just go ahead.
Sir, yes, actually, that was my dream, not to waste any time in between. And on the other side, I'm a little scared also that I have to continue. It will be a long stretch and it would be a little exhausting. But I have some plans to do after this. So I want to have some more, beyond this, I have some fellowships plans. So it's good that I save time for that, actually.
Good. So happy to hear that from you. And I think the viewers also have got an idea on the general exam pattern of INI. Now, this is a general question which I ask you, Sai. As a medicine resident, okay, somebody listening to you might be a first year resident. What advice as a senior will you give them to shape their residency? Like how to go about first year, second year, and third year in an outline?
So first priority should be they have to focus on their medicine. Whatever super specialty they are going to select, first be thorough with the medicine. Especially in the first year, you need to go to wards, go to emergency, see the patients, then come back. And second year will be mainly the learning. Whatever you have seen, you just read in the book and confirm, okay, this is the things which I have done right, this is things which I did not do right. So that will help you consolidate the information which you have seen in the first year. And I think by third year, you can start preparing for your DM, or else at the end of the second year. And neuro would take hardly, if you know the plan how to prepare for your super specialty, it would hardly take you 6 months. So I think you'll have enough time in the final year to prepare for that. I would dedicate 2 years for medicine, and then last in the final year you can plan for super specialty.
Yeah, very, very important message coming for the juniors, because it's always important to focus on medicine first. None of the candidates who take a medicine seat, an MD medicine or DNB medicine seat, please don't think it to be a bridge course to your super specialty. As Sai rightly said, focus on medicine. And then from there, you generate an interest for the corresponding super specialty. Because ultimately, even if you become a super specialist, because now Sai is going to go to DM Neurology, obviously he is going to encounter cases of cardioembolic stroke. He is going to encounter chronic kidney disease patient with stroke. So he has to be good in his medicine part itself, because if you just focus on one subspecialty alone, it's like a tunnel vision. You just see that. Okay, so which is a very important message that Sai has given all you juniors. So Sai, everyone at home must be very happy. What did your parents say?
Yes, sir. Actually, everyone has, even me, I am surprised to see the second. I was only wishing for a seat in the one here in the AIIMS, but I got a second rank. That's a great achievement, and everyone is happy.
Okay, so after your interview, did you say to your parents that I have a chance, or I don't know, what did you say?
I have a chance to get into, but I didn't expect, actually, honestly, the second rank.
All right. So, so happy that you have achieved the top rank, because second rank at the national level for such a competitive exam, and you have fared equally well for the MCQ round and the interview round. You have kept that second position itself going ahead. So it is such a proud feeling also for all of us. So hearty congratulations once again, Sai, and all the best. See you soon in some neurology conference. Okay, so meeting forward for a big party also when we meet. Okay.
Sure, sir. Thank you so much. Thank you.
Bye-bye. Bye-bye.